this lesson, we're going to look at preventing falls for your patient and preventing injuries for you. Fall prevention is a huge deal. It's a big deal from the Joint Commission. It's a big deal from CMS. And it's part of hospital regulation. So they consider them sentinel events. They're expensive. They're not reimbursed by insurance. They're not reimbursed by Medicare. They add link to the state of the hospital. Honestly, falls suck. And the best way to reduce falls is to prevent them. And so what we have to do is we have to figure out, well, who's at risk for a fall? And so that's what we're going to look at here. And younger and older patients are going to be at your highest risk for falls. So your younger patients are going to be your peds patients, your little tiny babies. Mom falls asleep, baby falls out of their arms. It happens. It's sad. It's terrible for everybody, but it's considered a fall. So your patient is going to be your younger patient. Also your older patients, your elderly, your geriatrics, they're also going to be, because it's just one of the effects of getting older. Dexterity, mobility, cognition, all of these things are affected. So they are going to they run a higher risk of, like we talked about cognition, it's going to cause a much higher risk. Also, education and understanding. Do they know when to get out of bed? When they know not to get out of the bed? Are they potentially altered in some way? Do they not understand? These things are also going to affect their ability or their risk for falling. Another risk are tripping hazards. So SCDs, the sequential compression devices. So on your patient, they have a cool little thing. So your machine's here and your tubing comes up here. And what happens is there's a tubing that's here. A lot of times you can just disconnect it right here and then tuck it inside. There's usually like little flaps. You can tuck it inside the flap if your patient doesn't want to take the SCD off. The best thing to do is always take the SCD off so that you don't actually run the risk of them, either you forget it or they forget it or they try to get out of bed. Hey, just take these guys off. The other thing that you could have in the room is other equipment like IV poles, tubes, lines, anything like that. That can actually increase the possibility of someone tripping. So when you go into the room, take a look around. Do a quick sweep. Hey, is this cord going to cause my patient to trip? Is this cord that's laying across the room going to cause my family member to trip? It's not uncommon to see Meemaw in the hospital room with Pawpaw, because Pawpaw's in the hospital and Meemaw's trying to walk across the room and she trips and falls. That will be terrible for everybody. So just look around. Now let's take a look at some ways to prevent falls. When we look at prevention, these are the things that you as the nurse can do. So call light. This is a huge thing. I can't tell you how many times I've worked with people, and I've even forgot this sometimes, but does your call light work? Make sure your call light works. Make sure your patient, it's within reach. Make sure your patient knows how to use it. Hey, this is your call light. This is who you will actually get me directly. Hit this button if you have a problem. Make sure it's plugged into the wall. It's a common problem in that, hey, my patient has a call light. Hey, they know which button to press. Hey, they understand. But, all of a sudden you hear your patient yelling and you're trying to figure out, why are you yelling? Just use a call light. Well, it's not working. Well, that's kind of on you. Make sure your call light works. Make sure it's plugged in. Make sure your room's decluttered. Pick stuff off the floor. Make sure they have easy walking paths. Make sure they don't have any tripping hazards. Give them those cool yellow socks. Those things are surprisingly uncomfortable, but just make sure they have it because they've got the skid resistance on the bottom, and just make sure that they have the ability to, when they walk, they're not going to run the risk of slipping. Make sure your room is well lit. Make sure that you're offering your patient frequent toileting. Do they need to get up? Are they incontinent? Are they getting a ton of fluid? Do they have to go to the bathroom? Then if you get your patient out of bed to toilet frequently, or have your UAP help you to get up, ambulate, mobilize, and toilet, then you actually reduce the risk of them wanting to be like, oh, hey, I need to go to the bathroom and no one's here to help me. I'm going to get out of bed and strip all my SCDs that are not unplugged from the machine. So just offer them that option so that you're not running in there. If your patient is what we call WADI, love this term. It's wild and dangerous. If your patient, it basically implies that a patient is somewhat non-compliant, and then they have a tendency to get out of bed, and that they have a tendency to not listen, and they're not going to understand, and they're going to be a little bit watty. Turn this guy on. Turn your bed alarm on, so that if they're not going to tell you that they want to get out of bed, your bed alarm will. Make sure bed alarm works too. For your patients that are going to have mobility issues, you're going to use some assistive devices. So these are walkers, canes, wheelchairs, crutches. While they will help your patient to mobilize, they also pose a risk. And so what you have to do as the nurse is you have to make sure they have an understanding of how to properly use this. It's not everybody inherently knows how to use a walker or a cane or to be in a wheelchair. And with wheelchairs, it's not necessarily they know how to use a wheelchair, but it's that they know how to safely get in and out of it. Because your patients, I've had patients that have had like pelvic fractures, and they can't be weight bearing. And so they have to be in a wheelchair. Make sure that they can transfer safely in and out of it. If they have to use crutches, make sure that they're not, because once that crutch crosses midline, they're going to trip and fall. So make sure that they know how to use all these safely. So see one, do one, teach one. So show your patient, have them do it, and then have them teach it back to you, so that they can show that they can show you that they know how to properly use whatever assistive device they're using. Now that we've talked about protecting your patient, let's talk about protecting you as the nurse. We are prone to injury, and the only reason is because we think that we can usually do more than we can. And so you'll often hear nurses say, protect your back. And it couldn't be any further from the truth. You have to do whatever you can to make sure that you're protecting your back. And this goes back to proper body mechanics. You always want to make sure that you lift with your legs. So if you have to use, if you're moving a patient from like the chair to the bed, don't use your back to bend over, use your legs to help stabilize yourself. You never want to bend and twist. This is one of the leading causes for lower back injuries, especially among nurses. So never like bend over, and as you're lifting up, twist. I can attest to it. I've done it. It is terrible. It hurts. Don't do it. Always make sure you're using proper body mechanics. Stepping up is a little bit different. So I'm going to draw you a picture. So you have a patient that's slid down in bed. Here's your patient. And they need to move this way. You're not going to stand here at the patient's side right here and literally twist to move them up. You're actually going to lift them off the bed with the draw sheet typically and step towards the top of the bed. And you avoid twisting, and you'll actually keep your back in pretty good health. So if you don't do it, you're going to turn around and you're going to have some back pain at the end of the day. So always make sure that you step up towards the top of the bed instead of twisting to move your patient up in bed. So we've talked about some things that you can do to yourself in terms of body mechanics to prevent injury. Here's some things that you can do to make your life easier. So I'm like 6 foot tall. And those patients, if I were to have a patient's bed and they need an IV, here's Mr. Smith, right? And this is me. If I need to put an IV, I'm going to actually have to bend down to do this. So what's going on? Mr. Smith is going for a ride. And I usually tell him that, hey, we're going to go for a quick ride. I'm tall. I need to put this IV in. We're going to raise your bed up. And just to make sure that I don't kill my back. I've just been flat out honest with them. And by doing so, you're building rapport, but at the same time, you're protecting your back. And I've done them. If sometimes I've had patients that are like, hey, I'm really scared. I don't want that bed to be high. I'll pull up a chair. I'll grab the bedside chair and I'll sit next to him and put that IV in. So you want to make sure that your bed height is appropriate for what you're doing. The other thing, use PT and OT. These guys are great. Make sure they're going to be getting your patients out of bed. So if you can coordinate care with them, let's say your physical therapist says, hey, we want to work with a patient at 9 and the doctor wants him out of bed. Just say, hey, I'm going to work physical therapy at 9. We're going to get them out of bed. They're going to mobilize them, and then we're going to put them in a chair. So just coordinate your care. You have the people that are assistants. You've got these guys are pros in terms of body mechanics and making patients do what they need to in terms of getting out of bed. But just coordinate your care with them. Also, if you need to do something like moving your patient up in bed, grab help. Grab a couple of nurses, use that draw sheet, and write up. You want to make sure that you're working smarter, not harder. In today's lesson, nursing concepts for this lesson focus really on safety, not only for your patient, but also for you. So let's recap. When you're working with your patient, make sure you look around and that you identify any fall risks for that patient. Make sure your call light is working, make sure it's within reach, make sure they're not just screaming because it's not working. Making sure your patient understands that they need to stay in bed or that they need to call you before they get out of bed. It's not that they can't get out of bed. It's you want to make sure that you've educated and make sure that they have a good understanding of the risks that are actually present. You want to work smarter, not harder. So get help. Don't overextend yourself. Make sure you're using your therapies like physical therapy and occupational therapy, and protect your back by using proper body mechanics. So that's our lesson on fall and injury prevention. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.